Hello, my name is Naomi, and today I will be administering morphine to my client Elizabeth Bennett. She was complaining of 5 out of 10 pain earlier today, so I can see on her MAR that she does have a dose of morphine, 2 milligrams IV. She has not had a dose yet today, and so I'm going to get that prepared for her. Before pulling out the medication, I am going to consult the IV monograph for morphine here. All right, so for morphine here, I can see that it can be given IV direct. I'm going to mix it with 5 to 10 milliliters of normal saline, and I'm going to take note of the rate. It is 2 milligrams per minute. I am administering 2 milligrams here outlined on the MAR, so I am going to make sure that I administer the medication over 1 minute. All right, so I'm going to perform my first check pulling out the medication here. I have normal saline, expires 2024. I'm making note of that because of video purposes, just with resources. I'm going to use it, but obviously will not use it in a real world situation. And then I also have morphine. It is also 2035, so okay to use. It has already been opened, but due to the uses of this video, I'm going to use it. All right, and I already have done my medication, or my math, sorry. So over here you can see that I'm going to have 10 milliliters in the syringe, total 1 milliliter of the medication and 9 milliliters of the normal saline. And then I will waste 8 milliliters in order for get the desired dose of 2 milliliters of morphine. All right, so I'm going to take the normal saline here. First of all, I'm just going to and for time purposes, this is not going to be 30 seconds and not letting it dry for a long time, but that is what it is. I've also technically cleaned the morphine, but anyways, because I'm drying up from an ampule, I do have a filter needle here. I'm going to draw up, according to my math, 9 milliliters of normal saline. So I'm going to inject 9 milliliters of air into the normal saline here. All right. It is because it's been used so many times that would happen. Obviously, that would not happen in a real world situation. Perfect. Liters, perfect. All right. And I'm also going to draw up 1 ml of normal, of the medication rather. Perfect. All right. Perfect. And I'm also just going to invert to mix the medication together. All right, and I have the medication label here, so I'm going to put that on the medication. At this point, I'm also going to go through my rights to ensure that I have the right medication for the right patient. So, right patient, I have Elizabeth Bennett. Right drug, this is morphine for her pain. The right dosage, I do have the 2 milligrams here. At this point, I am going to make sure that I have the correct amount. So, I know from my math that I want to waste 8 milliliters of the medication. So I'm going to do that here. Ensuring I have 2 milliliters of the solution left. I am just going to scoop that medication there. Perfect. So I have the right dosage for the patient. Right route, I know that this has been ordered to give IV direct. I know from the IV monograph that I can give it direct. Right time, she has not received a dose yet, so it is okay to give. And the right reason, obviously, for her pain. So I am going to take this to the bedside with everything else that I need. I would also do my second check putting this away, but for the video purposes, I'm just going to leave these out. But I know expiry of the normal saline and as well expiry of the morphine here. Perfect. I'm going to take all of this over to the bedside. Normally I wouldn't take a needle to the bedside, but just to keep it sterile, I am going to leave it on there. I am making note of that. All right. Hi, Elizabeth. Can you tell me your last name and your date of birth? Perfect. Thank you very much. Ensuring that she doesn't have allergies as well. I'm going to put on my medication, or my gloves here. I also normally wouldn't take a MAR to the bedside, but for video purposes, just to consult the name and the date of birth, I do have it here. All right, so I have an intermittent infusion device here. I'm going to unclamp it, and I am going to prepare my normal saline here. Have it right there, and I am going to clean the port. For timely reasons for the video, it won't be 30 seconds and letting it dry, but I would do that in normal practice. This is also sterile now with the tip, so I would just let the air out. And I'm going to assess the IV site as I infuse at least 3 milliliters of normal saline just to ensure patency. And the IV site looks good. I'm making sure not to move anything or not let anything touch. Again, like I said, this is still sterile because it hasn't moved, so I'm going to put that on. Perfect. And like I said with the IV drug monograph, this would be over 1 full minute that I would infuse this medication, so this would be much slower, but for the timely nature of this video, I'm going to push it a little bit faster. Perfect. Once I have administered all of the medication, I'm going to put this aside. I'm going to get another IV flush. If I can open it. All right. I'm going to let the air out. And for this, I am going to administer this normal saline at the exact same rate that I administered the medication. So this would be 2 milligrams or 2 milliliters over 1 minute. Again, for time sensitivity, I am not going to do it for an entire minute. But that is how I would do that, ensuring that there's patency. And then I would also use I would do a little bit more and use the push pause effect to clamp. All right, and I will leave that here, leaving it clamped. Again, assessing the IV site, ensuring that there is no fluid going interstitial. And I would check on my patient again in 30 minutes to ensure that the pain medication has done its job. Thank you.